So, hello, our fellow veterinarians and all the public who want to hear about veterinary careers. I'm Dr. Donna DeBonis, and this is season 1, episode 4 for the American Association of Food Safety and Public Health Veterinarians. Today, our guest is Dr. Pam Abney. She is going to tell us about the many different manifestations of her veterinary career. And I'd like to welcome her and tell us about where it all began. Pam, where are you from and what brought you into veterinary medicine?
Well, okay, I was born in the 1950s. I'm an old gal, but I grew up in the South. What I will commonly call is the segregated sexist South in the 50s.
Sexist, don't forget that. Yeah,
well,
people forget that.
Mm-hmm. Segregated sexist South, yes. But you know, it was I grew up in the rural Alabama, in Marshall County, and close to Gunnersville, northeast part of the state, on the river, on the lake there. And moving to the farm when I was about 10 really was wonderful for me because we had cows, we had pigs, I got to have a horse.
Yes.
I was always dragging animals home, you know, little bunnies. I would sneak into my room. Mother never knew what she was gonna find there. So I always had a love and a way with animals. You know, I would go off but I remember seeing bobcats in the woods and all kinds of things, and I would just climb up in a tree and watch the world go by.
Just wandering. You were just living your best life, wandering in the woods, and you had your horse. 100% remember that for me too. Go ahead.
I remember it.
Yeah,
it's wonderful.
Beautiful.
So, and I love school. I also, you know, I love school. But being out in the country, we were the first on the school bus. We'd walk down to the road in the dark to catch the school bus at 6:30 in the morning.
Right.
So first on, last off. So I had my homework done. Anyway, long story short is I love school, and I knew I wanted to do something with my life. I wanted to go see the world. I wanted to be my own boss and not rely on anyone. So that meant I needed to have a career. And I was good in science. You know, I tested well in math and science, and started looking at careers in medicine, laboratory work,
right?
Nurse anesthetist. I looked at nurse anesthetist. I went to a junior college for my first year, and got encouraged to get involved in medicine, human medicine. So I went off to the University of Alabama in pre-med.
Oh, and okay.
That's kind of how I started. And
they have a med school there too, right? And a vet school?
Well, at UAB in Birmingham. So,
okay.
But they had the pre-med curriculum there. And it's kind of an interesting story how I never thought of veterinary medicine in the sense that there were no role models. And I do remember going and talking to our town veterinarian at the time who—
Now, wait a minute. There were no role models. You mean there were no women veterinarians you knew?
No.
Oh, wow. Okay.
There were very few. I mean, it was just starting even in the medical, you know, in the human side, you know, there were no veterinarians in the—
oh, sure. Female doctors. Yeah. Okay. That was just starting too.
Just started, and that was something. But the veterinarian in my town, when I went and talked to him, basically said he was very discouraging. He basically, because from an economic perspective, from an economic perspective, he just said, look, he said, here's how it is, you know, putting aside the physical thing about, you know, not big enough, tough enough, because I was a skinny little kid, and but I was tough and wiry, and he just looked at the economics. He said, when things go bad, when the economy goes bad, said the first thing that happens, and in the rural South or rural people, you know, they didn't go to the veterinarian. They didn't spend money. They, you know, their method of euthanasia was a bullet. I mean, it was kind of, you know, that's how it was. And so off I went to pre-med.
Okay, and, that's fair. Yeah.
And I'm not sure exactly what happened, other than I remember going through a year going through a set of finals, and you know how you're always running, it was real competitive. And I missed an A by like 2, well, that what cutoff was 2 points away or whatever. And well, the other thing that happened is I worked in a human hospital one summer as a ward
Oh,
clerk.
smart. Okay, see what you think.
Okay.
Right.
So I wanted to kind of test drive it. And I realized that it might not be, well, you know, see quantity people.
Right.
Day in and day out.
Right.
You know,
Yeah.
And often thankless.
Working on people. Sure.
You know, so I looked at that and I thought, okay, you know, and anyway, I was coming home and I stopped to see a friend of mine, and they mentioned to me, they said, Pam, you've always loved animals. Why don't you think about being a veterinarian? Because I'm going, I just don't know if I'm going, veterinarian? I just didn't think it was a thing. But then
Well,
I thought,
part of it
well, let me
too,
look into it.
Yeah, part of it too is it was not just a matter of like you always loved animals, but you were on a farm at 10 and your family had cattle and swine and chickens. And I imagine that you developed a sort of an expertise doing routine things for animal husbandry, right?
Oh, no, absolutely. I fed, watered, took care of, and I was there when the vet, and it's not all, you know, it's not all warm and fuzzy, and you know, there's tough stuff that happens. And you know, I still remember finding the calf, you know, the dystocia cow, the having to do a phytotomy. I still remember my dad yelling, help, I need help, and carrying this little calf that had the flies had gotten to it, and it was just covered in maggots, and we had to pick maggots off of this calf. No, it was,
yeah,
you know, you can't, you know, you gotta be tough, but it is very rewarding. And
well, by the way, the thing about the difference is you could handle that kind of stuff with animals. I've noticed that too. There's something going on with an animal, like the whole maggot story. Okay, yeah, you get in there, you take them off, you don't feel like you're gonna barf. But I guarantee you, if I was doing that with, let's say, a human child, I think I'd freeze up and freak out. Okay,
well,
so you know, in some ways I feel we're drawn to something, and veterinary medicine, you have to have that ability to kind of compartmentalize and do the job. And obviously you were able to do that.
Oh yes, you have to learn, you have to be objective. You have to be, whatever the situation, whether you're in an exam room or in the middle of a crisis, dealing with a recall or whatever, you know, you've got to be the objective person to think through and solve the problems, you know. And it was often hard in practice. There's, you know, I've had major career paths, but going back to how I decided, actually, it was kind of funny when I looked into going to veterinary medicine, I found out at that time that it was much more difficult to get into veterinary school than medical school.
Right, because there were only about 20, I want to say like 21 or 22 vet schools in the 70s.
In the 70s, there were, I think at that time, 16 or 17.
Okay.
Because well, anyway, so it became a challenge. It kind of became a challenge for me. And I decided, why go for it? Why not? This is, and so I have this funny, sort of the funny story of, but I'd gone, you know, in the South, football is a big thing, cross-state rivalries, and University of Alabama did not have a pre-veterinary medicine program.
Mm-hmm.
Auburn had the vet school, had a veterinary school, and the program. So I had to get myself into Auburn quickly when I switched that during that winter semester, and go take some pre-vet courses and apply. But I still remember going for that first interview, because I got it done. I got the pre-vet courses done. And I still remember going to that interview.
Oh, you're talking about going to the interview because they invited you to an interview to get about getting accepted to vet school?
Right. Right. So I was able
Okay.
to switch, get my pre-vet stuff, and granted the interview. I did
Oh.
not get in my first year, but the
Mhm.
questions they asked me, it was kind of interesting because I had a very high grade point average. I made all A's in my pre-vet courses at Auburn. But
What year? What year was that about?
that was in 1974.
Okay.
It was in 1974, and I still remember going to the interview. And at that time, I was a cute thing back then, and I was thin, and I still remember being told that, well, first of all, they had concerns because why did I go to the University of Alabama? Well, my mother, I was mother had gone to the University of Alabama, and I was in pre-med but first. And so then the next question was, you just don't look like a veterinarian. And I said, well, what do you mean I don't look like a veterinarian? Because there I was, with the fair hair and the, kind of,
You had Farrah hair.
I had fair hair, and I had, I was, I had a body that was kind of cute, but I was strong and I was wiry, and they did not believe I had a farm background. It was like, well, you don't look like you came from a farm. You don't look like you grew up on a farm. And I'm thinking, oh my God,
That's
some of the other questions.
There's no way you could prepare for that interview.
Well, it was interesting. So actually, so it was pretty much like, I think, I had the credentials, but they doubted I guess looking back, I could say, okay, where did I come from? I kind of came out of nowhere, right?
Sure.
So anyway, I went back. I had not graduated yet from Alabama, so I went back and finished up my degree and wound up going to work at Southern Research Institute for about a year, applied again the next year and got in. So that's sort of the story. But in getting in vet school, I got to tell you this story. There were 35 slots for Alabama. They had a class of 115. There were 35 slots from Alabama. The rest were from states,
the surrounding states.
They did not have vet schools yet, or they were thinking about building them but didn't have classes. Florida, Mississippi, Louisiana, Tennessee, North Carolina, Kentucky. And I don't think they had very many at-large spots. But anyway, of the 35 from Alabama, there were, I think, just 3 of us girls. And I still remember, I won't mention any names, but she's still a good friend of mine. We became friends in pre-vet. I still remember we both got in that same year, and we were so excited, and we're standing there. And I still remember a classmate coming up, chewing tobacco.
Yep.
And we were all excited to be there. And he looked up, he came and looked us up, down.
Yeah.
Spit tobacco at our feet.
He spit tobacco?
Listen, looked at us and said, my best friend didn't get in vet school because of you girls. What use are you? All you're going to do is get married and have kids.
Yeah. Yeah. Yeah, I got that in pre-vet. Yeah, we were already in, and this guy was in our class. Yeah. So needless to say, we still, there were, and there were stories, there were a few professors who in later years have apologized for their transgressions and their comments and their they realized they were wrong, because women can do a great job, if not a better job in some situations, because especially in small animal medicine, because actually animals, I could handle animals. I could handle them better, and they were better around me doing things to them than the guys. Yeah. Because women are the caregivers, and there were some big advantages. Yeah. Being gentle and having a calm approach, basically, rather than wrangle them, let's say. Right. So basically what you're talking about is a time in veterinary medicine where it was knocking down walls essentially. And, you know, you get in at that was before there was affirmative action. I confess I was part of affirmative action. I got into vet school about 5 years after you did. And again, not the first time, but anyway, that's another story. I hope to share it in the future. But the point is that that once you got into vet school, it even was challenging. So fast forward, here you are in vet school. What did you think you were going to be doing? You know, what was your career going to be when you got out of vet school? What did you plan that you were going to do?
Well, in veterinary school, you know, Laura and I, well, we were student residents together too. I took advantage and did everything I could. I was work study, so I had to pay my way through vet school. So I borrowed some money and I did work study, but I would work quarter breaks in the clinics. Another female and I were student residents. We were not the first, but we were the second pair that were student residents, and where you actually lived in the clinic. We lived in the, had a little apartment there in the clinic, and we took emergencies after hours and worked with the interns and residents.
Wow.
So it kind of gave you a leg up, gave you some extra. We had Dr. Horline there, who was a famous neurologist, did a lot of hemilaminectomies. And so we got a lot of docs and dumps on holidays to the clinics there. Got good experience doing that. And I think it also helped me to get accepted to an internship. I did not go straight out into practice. When I left Auburn, I went to the Animal Medical Center in New York City.
Oh, that's how you ended up. I didn't understand how you got to New York. That's kind of so weird. You're a Southern girl, and how did you, New York. And then what I find interesting too is that you looked at doing an internship. Again, it's not required in veterinary medicine. We can come out and just start practicing, but here you were thinking about doing an internship at a time when it was not something that people even knew. As a veterinary student, it didn't even occur to me. I was like, I just got to get out and start working. I need money.
It was important. Keep in mind, the year between when I worked at Southern Research Institute as a biologist, it was really hard work, working in a lab, injecting mice, standing on, doing all that. And the pay was not great. And veterinary school, you think, would be better. But at that time, because I graduated in 1979, people were going out into clinics and making $18,000 a year, something like that. And
right.
It was even for that time, it was not a whole lot, it was like, dang, this is not great. And I wanted to see the world. I wanted to fly. I wanted to go see the world. I wanted to go experience. I wanted to go somewhere different. And I did apply to a bunch, but AMC, the Animal Medical Center, was my first choice. And I think I interviewed well, and I let them know. I mean, I decided, tough as it was, that was going to be great for me, and it was great for me to do that internship. It was very hard, but long hours. But that internship opened so many doors for me. It opened so many doors for me. But after that, I mean, we had 75, 80-hour weeks. It was grueling. But you came out of there having experience that you would have had maybe 5, 6, 7 years in a good practice. I mean, it was pretty intense. And it was so prestigious. Let's face it, it's very prestigious to have done that there at Animal Medical Center in New York. Yeah, very good. So then where did that lead you at that point? Well, before I had student debt. I had debt. They wanted me to apply for residencies, and I said, I'm tired of being poor. I want to work. Right. I want to travel. Yeah, it's a driving force at that point. Yeah, it was. And once I put the word out that I was interested, I had, a lot of practitioners offered me, it was easy to find work, but I accepted a position at a place called Manhattan Veterinary Group at the time. They, the owner of that hospital was very well respected. He was one who allowed you to practice really good medicine, and he would, if you could show him that your way was as good, if not better than what he would do, he would let you do it, as opposed to, you know, I know some people I know have gone to work in practices where they were told, you can't do this, you can't do that. And I didn't want to live that way. So I took this job, and they had an emergency clinic also. So you had the Animal Medical Center 24/7, and Manhattan Vet Group, which was on 80th Street, about 18 blocks away. And they had an emergency clinic, and it was great for me because I was kind of a night owl. And I would, you know, go work, do emergency, do surgeries if we had to. And then our crew would go out, you know, dancing till dawn or whatever. And I'd come home, go to sleep, get up.
Okay, then.
Go to the gym, go to work.
Okay, all right. Night
great.
owl, dancing till dawn. Who knew? I'm going to meet up with you at the next AVMA convention, okay? Deal?
Now that was in my 20s.
Okay, just checking.
That was in my 20s.
Okay, just checking. So Manhattan and yeah, I totally get it. We're compelled at some point, just through economics, get out there and get to work. But what I find interesting about your choice then is really you were playing to your strengths in a lot of way. You brought yourself to this certain point, and then you said, okay, emergencies, that's good. That's playing to my strengths. As I recall, emergency medicine usually pays a little bit more. So that going forward, you have a better chance of meeting your debt and obligations with that. What was next after that?
Well, I mean, the good thing about that, after an intern year, because as an intern, you didn't get paid very much. So when going to practice, you know, all of a sudden you kind of triple, quadruple what you were making and lived on the year before. Plus, I started doing relief work. So I had my job there, but I could do relief as much or as little as I wanted. And another condition of working, emergency was it gave me an opportunity to travel. So the deal I had with the owner was, here's the deal. I'll run the emergency clinic, but I'm going to travel, and I will get my replacements. I'll fill in behind me. I'll make sure the place is covered. But I learned to scuba dive. I learned to sail. I did a lot of fun things, and that worked out really well. So if I needed extra money, then I could, you know, if I wasn't working there, I could go do a few hours and then go to do emergency. And so I did that. And, you know, they did so much when I was in New York. So I did that for about 5 years. And over that 5 years, I evolved into, we need you some during the day. So I kind of did 3 nights and 2 days and sort of rolled around to a more regular schedule. Still love doing the emergencies, and I still did a lot of that. But I had a big trip planned. I was going to be gone for 3 months. And so it was kind of like, well, you can't leave for 3 months. And I said, well, yes, I can. Well, you travel more than I do. And I'm going, you know, you're the owner, you can do whatever you want. So anyway, long story short is, I said, you know what? I said, so I said, I'll give you 3 months. And I gave him 3 months notice. Went and did my trip. And then I came back. I was licensed at one time in about almost 15 states. So I looked at going to California. I looked at going to Nevada.
So you basically had working trips too, where you went to do your trip and then you got to work there too? Because you were licensed in these other places?
That trip was, it started out, I was a member of the, it was a Society of Aquatic Veterinary Medicine. They had, they would do scuba trips with CE, and they had a trip to the Maldives.
Oh, 100% on board with that. Yeah. Okay. Excuse the pun. Okay.
I did, you know, so I did this Maldives trip, but around that trip, I built trips to Sri Lanka and to Hong Kong during the Rugby Sevens. I had this whole big thing planned, and it was a trip of a lifetime. A friend of mine, I met a few friends along the way, started out scuba diving, met a few friends along the way, did the other things. You know, I won't waste time talking about that trip because that was just, you know, expatriates living abroad love people visiting from home, you know. So we
Okay,
were
good point. Yeah, they love to show around. Yeah, absolutely.
love
And
to show
visit.
you around, and it was nothing we could have planned. It just happened.
Evolved, sure.
Fantastic
So,
trip.
so at this point, you'd essentially given notice at the other job because of the whole issue of being gone for those
Yep.
3 months.
So I gave him notice. I worked it out. I said, gave him time to find somebody, train them, and then I took off.
Yeah. Now you're
Yep.
done with your 3-month trip. What do you have on the horizon?
So I'm like, okay, what am I going to do? I had some job offers in California, and what happened is Dr. McBride wanted to take a summer off, and he actually talked me into coming in and to LaGuardia Community College and teaching a vet tech course, a vet nursing course.
Oh, that
They
is
have
so
a veterinary
fun.
technician program. So I said, oh, okay, I'll come back to New York because I had a rent control apartment. I wasn't going to give that up easily. And so I came back and did that summer at LaGuardia Community College. It was a great experience. Teaching is tough. My mother's a teacher, my sister's a teacher, and I tell you, it's an open enrollment school. It was very rewarding, but it didn't pay very well at all. But it was a great experience, and I'm glad I did it. And by the time I finished that up, I had plenty of work. I had plenty of work lined up, and I pretty much stayed on.
Yeah, that's interesting how veterinarians, they just kind of pivot. And I think almost everyone I've talked to so far has said that they've had some stint in teaching to some degree. So this is and sometimes teaching is it. People, you know, veterinarians find that that's really their calling, and well, that's how we get our professors, certainly. But go on. So, you have brought your friend. Yeah, a quick shot of your kitty.
My kitty, my elderly kitty, she sleeps a lot now. She's, you know, that time of life when the kidneys start going. She's doing good. Yeah.
Oh, that's good. Yeah, she had to come over and say hi. I put my puppies outside completely because they're so rambunctious. They would start play fighting when I'm doing these recordings. It's just not just no. Okay, so now they're outside playing in the sun. So what did you end up doing then after teaching?
So I'm trying to talk. Okay.
Because I know that you had at one point were doing, was it your own practice when you ended up doing house calls? Tell me about that, because that sounds fascinating.
Okay, so when I finished up that summer, I said, no, I don't want a full-time position because the pay was terrible, and I was not interested in that. I still was paying off my student loans. And I just taken a 3-month trip to Southeast Asia. So I started working for a clinic down in Gramercy Park, had a kind of a full-time gig there, but I also, in addition to that, would do some relief days. And I had collected a bunch of clients that were just sort of, we want to follow you wherever or whatever. I said, no, I can't, I can't see you, whatever. But if they were elderly or if they had a bunch of cats, that in New York City, it's very difficult to get.
I can't even begin to imagine loading up a bunch of cats. And sometimes people don't even have cars in New York because it's hard to park, right? Yeah.
It's very difficult. So as a matter of convenience for them, for certain things that I knew wouldn't require, what's the right word? I couldn't do surgery. I couldn't, I didn't have an X-ray, but vaccines, routine things, let's take a look at it and see, and then I'll tell you if it needs to come in, come into the hospital or whatever. So I did literally, I put what I needed in the backpack, in my backpack, because you didn't want to be traveling around on the subways with people knowing that you might have syringes and drugs and things in your
So there,
person.
yeah,
I'm the
no branding or labeling thereof. Okay, so you had
Not
your
on subways,
your
no.
backpack on and you jumped on the subway. Wait, what?
and went and did my house calls, and you know, it was really funny. I'll tell a funny story too. I had worked out a deal with I did have a car that I would bring up in the summers, and then take somewhere back down south to leave for the winters, and did the alternate side of the street parking. But I had the old car, and I had this really wonderful client up in Spanish Harlem, and she had a whole bunch of little chihuahuas. Her husband was a mechanic, so he would work on my car, and I'd go back to feed her dogs for her.
Right?
You know,
yeah,
things like that.
The old trade.
Yeah.
Yeah. Definitely.
And I had some really some great clients too that just kind of became, you know, you got to know them. They were sort of, you would sometimes socialize, or they'd take you to I'll invite you over for dinner or whatever. There was some of that. Some of that.
Yeah. I find too that you do the most I ever. It's kind of interesting, and I had a house call practice for about 12, 13 years, and I don't know why, but people would give me presents, and that never happened when I had a clinic. I have to admit, you know, I kind of miss that, but yeah, that there's a certain bond you develop, and then yeah, it house call practice was really my best time in my career. So there you were in New York, and at this point you said you had licenses in so many states. I noticed that you know, you have a lot of licenses still active in states right now, even though you're retired. But like, what did you do?
I'm starting to let them go, but yeah.
Yeah, what'd you do after this stint of some house call stuff?
Okay, so well, all right. So I'm working in New York City, and what I didn't mention, and this is important. This is important. Organized veterinary medicine. Okay. When I was working at Manhattan Vet Group, one of the things that the owner of the hospital did there, Mike Martyr, was to basically say, hey, if you want to get involved with, they want to put you on the New York City Veterinary Medical Association board, I'll give you Wednesday afternoons off to go to those meetings once a month if you're interested. And I said, well, let me go see what it is. Okay. And I did. So I became involved in organized veterinary medicine early on, and have remained. I mean, it was a big part of. It also opened a lot of other doors down the road for where I went to after New York. But getting involved in organized veterinary medicine at that time, Ed Koch was mayor, and there were a lot of issues. There were a lot of issues that people were looking to veterinarians to support or not support. You know, carriage horses, pit bulls, dangerous dogs, this and that, a lot of things.
Oh, and animals in public housing.
Oh, pits. Well. Oh, okay. That's what I actually, yeah, that's a state thing that I was able to do. But
yeah, I saw you write. You had written that down too as some thing that you had got, you know, some kind of legal guidance that you provided, or guidance as a veterinarian's point of view. Is that what it was?
That came later. But getting involved in my local association, and then through that I got involved in my state association. And so work-wise, I was, went from Gramercy Park to work at the Bergh Memorial Hospital. This is kind of another segue where getting involved in organized veterinary medicine and knowing my colleagues, right, and doing relief work and knowing what that I could or couldn't do, and that I was pretty willing to tackle, anything. I was pretty, hey, why not? And so, but there was a chaired position. Someone had left an endowment to provide eye care for people that couldn't afford to go to the animal medical center, let's just say. Okay. And they were looking for someone in this chaired position, but they didn't want to hire a veterinary ophthalmologist per se. You know, they didn't want a
Okay.
boarded person because I guess they didn't want to pay them that, you know,
Sure.
that, and they also didn't have enough work to have them do that full time.
Mhm.
So I was actually recruited to look at this position, and I said, So they agreed to train me. I went back to AMC a day a week with the ophthalmologist there, did a stint at the Herman Eye Center in Houston. And I actually, for 5 years, was at Bergh Memorial Hospital, and I saw their eye cases, did some, you know, the advanced eye work, a lot of eyelid surgery and things like that. But I also handled their complicated medical cases.
And veterinarians are allowed to do this as long as we don't outright say we are a specialist when we're not boarded. We are allowed to do all of these procedures. Even I in private practice could say, yeah, I'm going to do eyelid surgery. And even though that wasn't my specialty, and we are allowed to do this. And in your case here, you were running this, you were in this chair position that was, as you said, an endowment money that was granted to support that position. So,
but I was also trained, but also I did have special training, and I went back with the ophthalmologist a day a week. So when he was not in New York City, he actually referred things to me at the Bergh Hospital to look at for him.
I'm not surprised that you went and you made sure you got lots of extra training, because that's just who you are.
So no, I wasn't going to do anything. You know, I didn't have, you know, I had the facilities and the instruments to do a lot of things, but I didn't do cataracts, for example, there. I did them at Bergh, you know, when I went back to AMC, you know, with the ophthalmologist there, but it was still a great service. I think it provided a lot of help to people that needed it. I saw a lot of Shar-Peis and Rottweilers and, you know, with the entropion, ectropion and those sorts of things. Cocker Spaniels and the like. But it was a great fun and a great position. And during that time, I was also involved in organized veterinary medicine. And I basically, in taking this chair position with Bergh Hospital, I basically said, here's the deal. Okay, I will come do medicine for you in your hospital, but I am advocating for and working for organized veterinary medicine for the profession, not for your not for the ASPCA adoption arm. You know, so the Bergh Hospital was separate at the time, and I negotiated that, and it worked well. You know, it's kind of like when we can work together, fine, but understand if we have positions that aren't the same on certain things, don't hire me if you're going to expect me to do that, because that's not what I'm being hired for. And that worked out really well. But I guess to point out that when you get in those situations, make sure it's clear and that you and it's very clear what you will or won't do when you go into a situation. If you're in a facility that has more than a veterinary hospital, let's say.
Okay. Yeah, I wasn't aware that was the case over there. So what was the next segue in your career from that chair, that position? Well,
okay, so while I was in that position and got involved at the state level, and we had some of our members from Staten Island that came to the board in New York City and said, hey, New Jersey has this lemon puppy law.
What?
Why don't we have, New Jersey has this lemon puppy law.
Okay.
Yeah. What they call the lemon puppy law. That basically says, you know, if you sell a dog or a cat, that you have to provide some assurance that it's healthy, like a guarantee, some assurance that it's healthy. You know, if people are going to pay $1,000 for an animal, you know, it needs to be vaccinated and make sure it's not incubating something 7 days, 10 days, whatever. Sure. And they had a law, and it worked really well. So we said, that's a good idea. So we took it to the state board, because a state law would have more heft than a local city law. And I won't get into the politics of that, but you know, sometimes even within our own within our own profession, there's cross purposes and some things that you have to be aware of. And so I came to find out that, you know, if you had some of your colleagues that were maybe working for a pet store, that they would not be happy about this bill, and that they would tell them.
Oh, okay.
So it was kind of an interesting education for me to see what happened. And as a result of that, they sent me up to the state to explain to the board what we wanted. And they said, okay, so we started working on it. But it was one that required a coalition. So you wanted to work with there's a group called PJacks, Pet Dealers Group. And I had clients that had horror stories. You know, you would see these animals and then you would have some of these stories that weren't so good. And
stories about the puppies that they had ended up buying, and it turned out that they had bought really a sick puppy, or had already some type of hereditary disease or what have you.
Yeah, and we also came to find out that at the time, you know, not only were they were shipping some of these animals directly from breeder farms and sending them to New York City, because what would happen is I'd say, why did you pick this one? It just looks like it needed, you know, it was sickly and it looked like it needed them. But then,
sure,
you know, you get into that. So it was not an unreasonable request. The law had worked well in New Jersey, but it was kind of interesting in looking at where some of the opposition came from within
the veterinary community was those veterinarians who were working, you know, that was their bread and butter, probably getting a nice, yeah.
Yeah, and at that time, you know, a lot of those same individuals were certainly kind of in control of the board, or in control, they were in those positions, and you kind of had to go, well, you know, you got to do what's best for the whole profession and for the animals too.
Right.
And I still remember at the time, the individual, when this first started, I was still at Gramercy Park. I hadn't gone to Bergh Hospital yet. And I still remember an individual coming to the guy that I was working for at that hospital, and who he still had a mortgage. He was still, the guy had the mortgage over his head. And he basically came and said, who's this girl working for you that's creating, you know, this situation, you know, up in Albany? And, you know, he told him, and he said, he basically implied that he needed to tell me to lay off.
Whoa.
Now,
did he come in? Was his name Guido?
I'm not going to mention any names, but
okay, just checking.
But the veterinarian that I was working for at the time actually told me about it. But he also told this individual that he said, you don't know her very well, do you?
Yeah.
And he goes, no. And he said, well, okay, I'll pass on the message, but you know, and he did. He told me, because he wanted me to know what was going on.
Yeah,
and you know, it made me mad. It really got me going. And
because part of it is ethics, I think, that drive us when we're working in these association positions. And we're really going for a higher ideal. As you said, we need to work for the animals. We need to work for the profession. Yeah.
It was not I mean, it was very balanced, and it was kind of like, look, you're selling a product. You need to, you know, it kind of helped. What this law, when it finally did get passed, because I was actually on the train to Albany the next week. We got this thing passed in 2 sessions, which was practically unheard of. But
wow, okay.
But it really, I'll have to say, you know, this guy probably did me a favor to really get the ball rolling, and we put together a hearing, and I had clients that came and testified, wrote letters about their experience. you know, and the state legislators were like, you know, okay, this, you know, we need to, it you know, wound up being a really good bill, and it put the bad dealers went out of business.
Well, yeah, at the end of the day, that's exactly what happened. Sure.
Which is not the best thing in a way, but either clean up your act or yeah. And
Yeah.
I think it was a good thing.
Yeah,
And
exactly.
I still have the bill signing signed by, I still have the bill signing. It was, I'm very proud of that.
Well, yeah, you should be. And so I got to know you because of the fact that that you're in the American Association of Food Safety Veterinarians, and you have served in position in our organization as well. It seems like that was the point where you began to, in a way, it's giving back to veterinary medicine. Would you say?
Oh, well, being involved in organized veterinary medicine, which is, you know, the you know, AAFSPHV group is a big part of that. Is you know, we all need to give back, because I think we're all better off when we work together. I love, New York City was a wonderful ground at the time, because we all helped each other too, in terms of if you had a tough case, you know, if you needed some help, you know, there was always somebody that come to the phone to help you, or
yeah, years ago. Yeah, same thing for me. Years ago, we were more like colleagues rather than competitors. And
Right.
I think when you're in a local association, especially, you begin to develop that kind of a network of people, you know, you can count on for certain things. So that actually is a good point as well. There's a lot to be said for joining associations at any level, really. So what was your next step? Because I know we stepped back a little bit to talk about this situation when you were working.
Well, interestingly, yeah. I'm sorry, I didn't mean to jump in on you. The interestingly enough, this work that I did in organized veterinary medicine, as a constituent, I was like a constituent lobbyist. I wasn't paid to do this, but I worked with our lobbyist in Albany, and I I actually chaired the legislative committee for the state for years, and we screened bills and looked at things. We helped Cornell, you know, we helped the college with funding. There's a lot of things that we can do as non-governmental organizations to help, you know, academics, to help students, to help people legislatively. And what's interesting about that is I did it because I loved doing it. It was kind of my social life too. I had a passion for it. And I have a colleague, I guess I can mention his name, Dr. Malcolm Cram, who he was a practitioner in New York. We worked together on the New York, he's actually the one that put me on the local VMA of New York City board to start with. And he had gone to Washington as a congressional fellow and had taken a job with AVMA, the American Veterinary Medical Association, in their Washington office, the Government Relations Division. Oh, and had been had been worked there for several years. And then he decided to go on to corporate America, make a little more money, go on to corporate America. And I remember him calling me and said, Pam, I want you to apply for this job with AVMA, you know, as a policy specialist. And I can't tell you my exact words, because, you know, being a New Yorker then, it was
okay, like, so no more shy girl
bleeping,
from the South. Okay. Are
you bleeping? Yeah. Are you bleeping nuts? I'm a practitioner. You know, I'm not. He said, no. He said, you don't understand. He says, you can do this job. Said, I've watched you. You've done this as a volunteer. I want you to apply for this job. And I'm like, whatever. And so a few weeks went by, and I had a few more calls, and some other things happened. And you know, living in New York City for almost 15 years, sometimes you think, oh my God, I don't know if I can live anywhere else. But I decided, why not? So I actually did go. I actually went and applied for the job and got it.
Okay.
So I moved to Washington, D.C. in 93.
Okay.
I guess toward the end of the year, 1993. So it was during the Clinton, and I was there for 10 years. I was actually in DC for 10 years with the AVMA.
And that's a real job.
That was a real job. You know, I managed to live, it paid pretty well, but, and I still did some emergency relief work out in Virginia on the weekends for a few years, but I got very busy because it was a real job, and it was a job that's kind of hard to explain. You know, when you're in practice, you know, you have these cases, animals get better or they don't get better, and you do what you do and things move on. When you're dealing with policy and legislative issues, and in particular association work as an employee, you have a stack of problems and they stay there, you know. It's like things just don't resolve on their own.
So you have to chip away and come at them from different. Okay, I didn't know that. I also didn't understand about the fact that you could be in such a position working on behalf of the AVMA. Like, besides having somebody come up and say to you, "Hey, I want you to apply for this position," I mean, where would you know about that kind of a position? It's in the, you know, on the AVMA website. Check out like where that how do you what kind of work is that called? Is that the part where it's working for an NGO, non-government organization?
Yeah.
Okay.
Yeah.
All right. So for those people who are drawn to something that's different but still so meaningful, this is a venue that no one has talked about yet. In the interviews that I've been doing, no one's has talked about this. I mean, we've all been part of associations and volunteered to and contributed and given back to veterinary medicine, but I must confess I've always been a little bit interested in working, you know, actual paid jobs for the AVMA. So this is exactly what you're talking about. Okay.
It was, and I tell you, you know, it's just kind of, it's really hard to describe, but for me, because I was so passionate and loved what I did as a volunteer, to actually get paid to do this, it was fantastic. I mean, I you know, I found a place to live, and I found that Washington, D.C. at the time was a fantastic place to live. They had great restaurants. There was a lot going on. It was conciliatory. The moderates were still were in power. The Main Street Republicans and the Blue Dog Dems kind of were here. And our issues in veterinary medicine are so diverse. I mean, our issues are, you know, we have business issues, we have education issues, we have food safety and public health issues, we have animal welfare issues. We have, you know, we're helping with students and student debt issues, and those issues are very broad and diverse. And you need both parties, and you need certain committees in particular you got to know who these people are, and they need to know who you are, so you can articulate and get the message across. While I was there.
So what you're saying is you actually spoke with our legislators.
Oh. No, my job, when the first 5 years I was there, I did policy. So AMDUCA, do you know what AMDUCA, the Animal Medicinal Drug Use Clarification Act?
No.
That allowed veterinarians to use drugs extra labelly legally.
Okay, which I did anyway, right? Okay.
Big thing.
Yes.
That happened. Well, I mean,
90% of the drugs we use are extra label.
Right.
There's no way a drug company is going to be happy with making a drug that's going to be used a very small niche. Yeah, exactly. Go ahead. Yeah.
That was a huge issue, and a huge issue at the time. Followed up with that with what they call MUMS, minor use, minor species. Okay. So this is something that sort of allowed certain drugs to be used in minor species. In other words, in addition to AMDUCA, and you have you know, it's very, very important for practitioners in zoo practice, you know, who are working on exotic species and things like that. And
so many different species. There's no way. And I remember having to rely on a huge TOMB, some TOMB book that you're trying to figure out dosages. There's nothing in the package insert for treating an ocelot, you know. Yeah. So yeah, 100%. I get what you're saying. Yeah. I think what I find so amazing though is I think of going to Washington DC, having this position. It's so beyond important, but you have to have a confidence and understanding already. And you had gained, your experience as a practitioner was important. Your experience as a teacher was important. Your experience going through vet school and internship, all of this came together because it made you the person who can do the job. And what's more important though, is really your experience in the different associations, the local one, Veterinary, New York City Veterinary Association, then the state, and then here you were essentially providing help to the federal government in making policy.
And I think for me, it was all that was very helpful because it gave me credibility with the AVMA members. In other words, it's like, Abney's there. Oh, we know her. She's one of us, you know, coming from the practice realm and coming from being so involved in organized veterinary medicine as a volunteer.
Right. And I've said this before to different veterinary groups that I'm on in Facebook. I said, come to our association. I know what you're saying. Oh, I'm not in food safety. I'm not in public health. Well, yeah, even clinicians are. They rely on talking to public health when zoonotic diseases are an issue. So come to our association and you can learn how to be a leader in veterinary medicine. Help us get things accomplished that we have to do. And this is a breeding ground, really. Any of these associations are, but ours in particular, I just want to say, it is a fantastic opportunity. We need a new incoming, the president that's taking over from me in August, as you said, Angela Demery. She's a fantastic veterinarian and she's going to be taking over my position. We need a new incoming president. You know, we're starting to beat the bushes trying to find someone. So anybody listening to this, you're welcome to apply. We need you.
Angela's great. So she was a congressional fellow and there's also AVMA has extern positions and the Congressional Fellowship, which I hope post-COVID they're going to be able to start back up soon. It's a great, you know, I never did do the fellowship, but I was lucky enough through my work in organized veterinary medicine to get into the position. And it was, it's hard to describe what all that goes into that, you know, working for an organization, you know, as staff, but I loved it. And part of it is we had you actually had to get to know not only the members, but their staff, their key staff people. You know, if this issue
in order to get to talk to them, you have to know the gatekeeper, right?
You got to know who the gatekeepers are. Yeah. You've got to be there. You've got to go to their events and remind them who you are. And me being a veterinarian who was a practitioner, actually, I think was helpful in a lot of ways because you could give them free veterinary advice.
Oh, 100% cocktail parties. People love you. Yeah, I get invited to a dinner with people, and first thing is like, oh, this Dr. DeBonis, she's a veterinarian, and I'm like, okay, here we go, hit the ground running. Yeah, it does. It gets you an in right away. Absolutely. Yeah.
But in the policy making arena in particular, you have so many people, and they move around. These young kids come to Washington, they move around. But if you can connect with them and they can get to know you and relate, it's all based on relationships too. If they get to know you and trust you, and you have some usefulness to them, because, you know, I can give you an example where there was a situation where a particular member had a problem in their district, and they called and said, hey, you know, can you help us with this issue in our district? You know, do you have, you know, and that's where the grassroots, you know, at the time called Congressional Action Network, we had members of veterinarians identified for each member of Congress, and hopefully developing personal relationships so that if we needed them, you know, to go talk to their staff in the district or whatever, they could do that or help them with something. And it's kind of useful. It's kind of like, well, if we can help you with this is great.
Mhm.
And you know, that's kind of what it's all about, is solving problems, making life better.
Yeah, well, it kind of reminds me in a way in the Army, the veterinarians deploy with the human health providers. And whenever there are any kind of issues about zoonotic diseases, let's say, they're like, oh, you know, get the veterinarian, because, you know, all of a sudden, even though we're not really part of the hospital staff, we are actually part of the medical team. So they're like, oh, no, that's the veterinarian's purview about the rabies thing. You know, find the veterinarian about that. So yeah, having a veterinarian assigned, I didn't realize that was even a thing, that veterinarians were, I hate to say this, I want to almost say, like, I didn't realize veterinarians were so important that they were each assigned. There was a veterinarian assigned to a lawmaker.
Well, that's what AVMA, that's part of what, you know, we started building on that way back then, and it's still going today. And, you know, they have the fly-ins, and, you know, you still go to events. Yeah, I just recently went to an event for a member of the House that I knew him when he came in as a freshman in '96, you know, and he's over a powerful approach committee now. Kind of you know, it's important to have those relationships and know and keep and maintain. And it takes a lot of work, a lot of shoe leather, you know. Bernadette, I don't know if you know Bernadette Dunham, Dr. Dunham, she and I were at AVMA together. She was, I love Bernadette. Gosh, she's fantastic. She left AVMA, she went to CVM and actually was director of FDA CVM for years. And she's at Georgetown now doing the One Health stuff. So anyway, but Bernadette, it was kind of funny. You know, she's a PhD, and
so just to say, she left being in the position like you were, Bernadette, and then she went to FDA CVM. That's FDA Center of Veterinary Medicine, and that's where again FDA, but the veterinary aspect. So she was there for some time. Okay, yeah. Always wondered how people got over into that one too. So so at this point, you're doing this, practicing a little bit on the side, because we never let that. We never give up practicing. But you know, I keep my license active too, and I say I'm retired, but yeah. It's just what we do. It's like we always go back to it. It's like sometimes we need money, and it's like, well, I'm retired, but oh, wait a minute, I have to. Okay, yeah. So what happened after this? And oh, before I forget, did you know that I took on position as alternate delegate for the Food Safety Committee for AVMA? I became alternate last month for that as one of the alternate
You
delegates.
mean the Legislative Advisory Committee?
Yeah, Legislative Advisory Committee. Yeah, for food safety. Yeah, I confess I don't know what I signed up for in some ways. It was just like, oh, food safety. Yes, I will do that, because I have my master's in food safety.
It's legislative. No, it's a little different. Legislative Advisory Committee is.
Yeah, we were. Yeah,
I didn't realize that had been filled. I had yeah, that's the natural. It's a lot of work. Just to let you know, it's a lot of work.
Yeah, I kind of noticed when they said it was going to be 2 days in a row, you know, 3 or 4 hours, and I was like, oh no. Clear my calendar. But yeah, I was really I enjoyed hearing them try to come up with the wording for certain types of advice and policies and so forth. So honest to God, I'm excited about it. But I mean, it's not anything I could have ever done when I was really in practice. It does require that commitment in terms of time and effort. You're right. Yeah. So anyway, here I am on your coattails, so to speak. What did you do after you left the AVMA position?
Oh, okay. Well, yeah, time-wise, it just, yeah, it, like I said, it was a wonderful time. But I was also there over the 9/11.
9/11, sure.
And 9/11, 2001. And I had, going back to being, I was a happy single girl in New York and most of the time in Washington, but I had wound up toward the end of the time I was in Washington, wound up getting married. 9/11 happened, and the world changed. Just there's a whole nother stories about how the world changed, how Washington changed, the Black Hawk helicopters going up and down, searchlights in your windows all night long. Soldiers with assault rifles on every corner, and just the way we had done life on the Hill, going in to the Capitol, going in, doing your educating, lobbying routine. The whole world changed. And anyway, long story short, is I decided that I needed to. My husband was in Alabama, and so. And my parents were getting on in years. And so I decided to, look for a change. I knew I didn't want to come back to clinical practice in rural Alabama. I knew that.
Sure. That would not go well. Yeah.
After practicing in Manhattan, I just knew I'd probably be arrested for assault, for someone coming in abusing their animal. So,
yeah, 100% get what you're talking about. Yeah.
So I'm looking around thinking, okay, what do I want to do? And there were some interesting options, possibly with corporate America in Atlanta, or with the Department of Homeland Security in Montgomery. But Guntersville was a location that, that's where I grew up and where SPASH unit was. So Dr. Bonnie Bunton, who was chief veterinarian for USDA at the time, suggested, she said, why don't you apply to go work for USDA? And I'm like, now, when I went to vet school, it was a different world. But she convinced me that the agency was more of a public health, food safety agency, and that it was worth considering. And there just so happened to be an opening in a location 7 miles from our farm in Alabama. And I decided, what the heck,
And so tell me what those initials stand for. Tell all of us again. UNCA, is that what you said? You're working, Bonnie said.
USDA, United States Department of Agriculture.
Oh, sorry. For some reason you cut out. Okay. USDA, United States Department of Agriculture. Okay. Right. Perfect. Go ahead.
And specifically the FSIS, or the Food Safety Inspection Service. So anyway, there was an opening, and I applied for it, and I was able to negotiate coming in at a high step. And I thought, let me give it a try. And actually, it was, I'll have to say, I enjoyed the job. It was, you did have to go into the processing plants, and they kind of took me and trained me. Even though I was an assigned position, they trained me in hemp methodology, the HACCP Improvement Model Project methodology pretty early on. So they kind of used me more as relief for the hemp plants. And I started out on second shift, which for this night owl at the time was perfect. Inspectors, I don't have children, so it was fun. I think I did a good job. Being from this area too was kind of interesting to it's hard to pull the wool over my eyes with travel miles and some things and shenanigans that were going on. It was kind of a challenging, fun time.
Mhm.
And I kind of got a little bit bored and said I need to do something different. So they had started a thing called enforcement, the EIAO program, Enforcement
Yeah.
Investigations Analysis Officers. And so I asked to be trained. They sent me to training, and then a full-time position came up a year later, and I applied for it and got it. So I was able to.
Yeah, I like the
then,
EIAO. I thought was something that I would have enjoyed doing as well. But the investigative aspect was very similar to the way we ran audits as Army food auditors. And so it was like just a very logical process, and that appealed to me. So so yeah, I don't blame you. That I didn't realize that that program started back then. I thought it was just always a thing.
No,
Yeah.
no, I think it kind of, you had HACCP, and the HACCP came along, and then with that evolved into having the EIO program to have some people that could go in and do more in-depth analysis of the food safety
just
system.
Really going into food safety, you didn't have necessarily a background like board certification, master's, experience as an Army food auditor, veterinary food auditor, and nothing like that. You were able at that time to go into that based on the fact that as a veterinarian, we know about food. And and that is really 100% of the qualifications that's needed for being into FSIS is really that being willing to get trained too. Training's a long time, several months, right?
They do train you, and you really need to you're really more involved in the regulatory process. So you just need to know the regulations and applying the regs to what the companies are doing.
Yeah.
Also pathogen, you need to know about pathogens.
Yeah,
Clearly,
medicine,
camping, et cetera, and meeting the
epidemiology, sure.
And a big part of your job, of course, is managing. You don't do the actual, you sort of manage a team of inspectors that in the old inspection methodology, you had USDA inspectors that sat and looked, and they still do bird by bird inspection, but you had, they also did like almost the initial screening. So you were kind of using regulatory people to do the initial screening, that why were taxpayer dollars being used for that? So that's kind of where NPIS, New Poultry Inspection System, came along to basically say, exactly, why should taxpayer dollars be used for quality control and for the initial sorting of carcasses that the plant can be doing? So the
and should be doing,
doing.
The plant workers need to be doing that.
Right. So you still have USDA looking at each and every bird on the line at the end. The line may be going a little bit faster, but most importantly, you have more inspectors on the floor doing tasks, food safety tasks, looking at birds more thoroughly and doing more of those tasks, and looking at the food as it's more likely to come out to the consumer. So so it's a better use of taxpayer dollars to do that.
Absolutely. So how long were you in that position?
So I worked for USDA in total about 14 years.
Oh, okay. So that's where you were really building up an actual retirement, so to speak, because the working for didn't you have like an
I did. I have a TSP, and I had a
TSP and everything, because in conventional clinical practice, we don't think about those things as a rule.
No, I did. No, I did. I always had I put money away every year. I had a 401k. When I was at the Bergh Hospital, I had a 457.
Oh my goodness.
You
Okay,
know,
so
I'm a
you're
saver.
completely on the ball with that sort of thing. Well, that's cool.
Yeah.
Yeah.
I always live like a squirrel. Yeah, live like a squirrel and save. I would travel and I would splurge, but I didn't have to have a new car and I never had to have a fancy place to live. So yeah.
Yeah,
But I did,
that's
but
yeah, which is another whole story because honestly, I don't know any veterinarians who have ever had a new car or a fancy place to live. Yeah, I was like telling my friend she'd come up and visit, but I might have to put you in a Airbnb. She's like, why can't I stay at your place? That's because I have 12 acres and I have horses and the house is like a little minuscule. The horses have the life.
oh gosh.
I was like a little embarrassed about having you come here, but no.
But being a regulatory veterinarian, you actually don't, you may not know this, but the federal government employs more veterinarians than we have in private practice, I think. If you look at
okay, no, I did not.
Services, FSIS, FDA, EPA, Department of Homeland Security.
Wait a minute, EPA?
Yeah.
Okay, didn't know that.
You got veterinarians everywhere. We've got a few veterinarians in the FBI. We got them everywhere.
In the FBI? Yeah. I knew about Homeland Security. That made sense. I after 9/11, when they were coming up with the various pillars of what kept our infrastructure together, it was like an afterthought that food and water supply. Yeah, but then that's how I found out veterinarians were involved with Homeland Security. But at any rate, so 14 years, were you looking at your career at that point and thinking, well, I'm just going to do this and then I'm going to retire and be out of, be actually have like my regular civilian life will begin? What was that like looking at 14 years?
It's kind of hard to say. I guess my career path has been very unplanned, I guess is the best way to put it. It has just sort of been a series of, doing. I'm so grateful and so lucky to have been able to do work that I felt in clinical practice, it was so rewarding because people came to you, they needed help, and you usually could help them. Sure. I can't imagine what it would be like doing cold calls for some financial trying to sell. I mean, I just can't even imagine.
Right.
And then I was able to my work with AVMA, in public policy was, my passion before that as a volunteer, I was getting paid to do. How lucky is that? Right. And then working for USDA, it worked out to be close to home. It was compared to my internship in private practice, it wasn't that hard. It was, you had to be willing to, you had to be tough, but going back to my farm background, not much grosses me out. You just put your gear on, put your helmet on and go deal with it. And a lot of it's about managing people, in managing teams and trying to stay positive and get the job done. But also, the old joke about, I have to tell you this one joke about the IIC inspector in charge. When I started with FSIS, I started out as an IIC, and I used to laugh and people would say, I'd say, what do you think IIC stands for? And they go, oh, inspector in charge. And I'm going, well, it's more like the idiot in the center. You're the idiot in the center because you've got your food inspectors here. Yeah. You've got the plant management here. You've got your district office and your boss is here. Yeah. And then you've got headquarters here, and you're kind of like
in the middle, and they're all demanding that you do what they want you to do.
Well, you just, so it is a lot to manage.
Right. You're adhering to the regulations, which you think would be fairly straightforward. Yeah.
Regulations, this is not the Federal Aviation Committee. They're designed to be, once HACCP came in, the regulations became less prescriptive, okay? HACCP allowed for more flexibility, for more generalized regulations, which allowed for inspection to use good judgment.
Good judgment is really what
Okay.
it boiled down to, right?
To achieve, and you can't argue with the fact that, good inspectors and good plant management want the same thing. They want a safe, wholesome product going to the consumer.
Yeah, nobody wants to
So-
poison anyone,
Absolutely
theoretically.
not.
Even though a cow carcass is worth several $100s, and no, they really don't want to throw it out. How dare you?
Well,
So, hey, I was yeah,
yeah.
I know.
Well, as an EIL, I did assessments in red meat plants and poultry plants and food processing plants and ready to eat. There was a lot to know and learn. But I think on the whole, everybody wants the same thing. So it's also very rewarding, and as a veterinarian in regulatory practice, yes, you do have retirement instruments, and you're able to, the government does match up to a certain percentage, and you have the thrift savings plan you can contribute
which is
to,
quite exciting, actually. So yeah.
which is good.
Yeah, that's cool.
And your OPM through OPM, the other great thing for me is that I actually signed up for my medical insurance, health insurance.
Yes, health
myself.
insurance. Yeah.
And at the time, I don't know if they still have this, but at the time, if you signed up for the health insurance within, 6 months of your employment and you continued that through, then when you retired, you could keep that. So I have Blue Cross Blue Shield Federal, and I'm able to keep that. And the government still pays part of those premiums.
Yeah, same as that is available with the active duty Army, and when they retire, the same benefit. That's a wonderful benefit. Yeah. So but before we close, and we're going to take a few minutes to do that, I wanted to ask you, you still maintain some type of volunteer time with different state associations, federal associations. What other times did you give back to veterinary medicine, as I like to put it? When did you join
that's a great
us?
question.
Yeah, when did you join us in the American Association
That's a great
of
question.
Food Safety and Public Health Veterinarians? When did you join?
I've also been involved, AVMA forever, since the beginning, and the DC VMA, of course, the New York and then DC, and I kept my DC. And I think Dr. Bunton actually mentioned
we're
this
going to be
group
talking
me.
at the end of this month for her interview.
She kind of kept telling me what a great group of people these were, and I kept trying to go, well, I can't find them, and then you'd meet at the AVMA meeting, but I was trying to go to. I'm also a member of the National Association of Federal Veterinarians, so there's a lot going on.
Yeah, they're one of our strategic partners.
Yeah,
sure.
So I came to a meeting. I think she told me about it, and so I finally got to a meeting, and joined up, and then the next year there was an opening for the director at large, and I thought, because I didn't, part of this group, you look at, it's a little intimidating, because you go, I'm just a veterinarian, I don't have like 50,000 letters after my DVM.
Yeah, we have some that have a lot of letters. Yes, they do. They're board certified.
Exactly.
MPH and what? Yeah.
Right. I mean, I've got a lot of practical experience, and I can get down the dirt with anybody. But it's just a great group of people. The talent and the experience, the diversity of memberships is huge.
It is.
And so I joined and have done the at-large. I've kind of been the more, back in the day, or done the old, my little bit, because of my background in organized veterinary medicine and my background with policy. I think that's been helpful. So
what you're saying is, when you joined, you almost immediately went into position as one of our people on our board of directors, correct?
Within the year, I think I remember sitting in a meeting, and there was a vacancy, and they said, we need, and I'm thinking, I said, well, if I qualify, and So
this is what I'm talking about, is that is really very much so. I mean, we say, hey, we have an opening, please apply and help. And we put the word out on our newsletter and our e-list, but I'm going to take the opportunity to tell people that we have some openings coming up. You know, reach out to me or Dr. Abney to see, like, hey, what all's involved? Would I qualify?
Well, let me tell you,
Are you
yeah,
breathing? Are you
that.
breathing? Do you have
It's a way? No. It is an honor and a privilege to serve.
Mhm.
And it is something that we need to give back to our profession that's given us so much. And so being involved, I've always been a proponent of and involved in organized veterinary medicine. You know, as I'm getting older, you know, you know, I have less, what's the right word? Less energy. You know, I used to be just like, oh, they're not going to, you know, they're not going to win. It's like the thing with on the train to Albany, you know, those bad guys aren't going to win, you know, and you still don't want them to win, but it's kind of like, let me see if I can get the young folks energized to do a lot of this.
That's pretty much what I do. I get onto the veterinary Facebook groups, and I'm like, hey guys, you know, this is your chance to get trained as a leader in veterinary medicine. You don't like what's happening at AVMA? Guess what? Come over here, learn how things work in an organization. This is your opportunity. Yeah.
I just also want to just kind of quickly, because I've had 4 major careers in this profession. So just, I think we forgot to, for the benefit of people listening this too, with, you know, going to practice, NGO work, government work, then as I'm, you know, 60, I was in my, you know, 60, what was I, 63-ish? And I'm going, okay, it's time to retire. 14 years with government. I'm giving them my notice, and I get this call.
Oh,
we need a director of food safety for this poultry company in Delaware.
See what I mean? Now, wait a minute. Nobody calls me and offers me jobs. I'm going to document this in the show notes of all the job offers that you had just because of people you know. I just want to say.
And through organized veterinary medicine primarily. So it is really, really important to networking and getting to know people. And if they know you, trust you, know your passion, it's just amazing.
Yeah, they want you on board with them. Yes, yeah. And I'm hearing what you say, and I feel in some ways like I missed so many opportunities because of that. I think I had my nose to the grindstone, and I was busy working so hard and with side hustle, other jobs, and oh my gosh, just trying so hard. I missed this fantastic chance to network when I was younger, and perhaps it would have opened up even more opportunities. But now we can tell all of you that this is the way to do it, folks. I keep telling, you know, young people, join us. We're, you know, this is a great chance. You're going to get to network and you get to mentor, because that's our next thing that we're opening up. We're really, really going to be backing our student outreach committee. And we have the main goals will be the sponsor, you know, going out there and sponsoring and mentoring, and also our scholarships. We're going to build up our scholarships. So yeah, this is the place to be now. So then when you went to go, you thought, oh, okay, I'm retiring. And then you went and worked the other job. What exactly was that other job that you were offered?
Well, so you know, when this call first came in, I'm like, but essentially they were looking for a director of food safety for the company. The responsibilities would include, of course, not on the live side. I'm not a poultry vet. I'm not trained as a poultry vet. They were, I think, more interested in me because of my background in policy and my background in government. You know, my 14 years with USDA, and in particular, a lot of work with hemp. You know, I'm kind of going, you know, I was an old gal by then too, So I thought, well, anyway, long story short is I decided to go give it a try. And I knew that
So
to
this
take a
is
job,
actually working for big business and
corporate America.
corporate America that was a production facility for poultry.
This was for the whole, this was corporate at the company. They had.
Oh, okay, at the company level. Okay, versus
the company
being
level.
standing in the corporate, yes, you standing in the corporate halls versus standing in
At the plant level. No, this is corporate.
The abattoirs. Yeah.
And well, you know.
Yeah.
And so it was an interesting experience. I'll have to say the company, it's a broiler company. It's, I think they're now the 4th or 5th largest. They just passed Wayne Farms in Purdue in size. And Mount Air Farms, and they were very good to me. They listened to me. The good thing about taking this job at my age with my background is I didn't have to have it. I didn't need, you know, it. I had heard, you know, you hear horror stories sometimes, and you hear, you know, about the golden cufflinks, and and I said, well, you know, I'll go try it, and if we don't like each other, then, you know, we're done, and nothing ventured, nothing lost. But I also
wait a minute. What golden cufflinks? What is that again?
Golden handcuffs.
Oh, handcuff. Okay, so where you're just a figurehead in a way, maybe, right?
No. Yeah. The golden handcuffs they pay you so well.
Okay. Yeah. Okay. Yeah.
But you have incentives to stay, meaning you have to stay X number of time, or you don't get this and you don't get that.
Oh, well, I missed that part completely too. Gosh.
Yeah. So if, you know, and I guess if COVID hadn't come along, I think I would have probably stayed a little bit longer, but I was just tired and ready, and I had accomplished my goals. We had everything done. They were all category 1 for pathogens. I had gone through and overseen and done the training to convert all their plants to NPIS, and a lot of great accomplishments there in
wow.
Like 4.5 years.
Wow.
And
okay.
So yeah, it was a great experience. And
so 2021, that was it.
I did retire. You know, part of it, you know, COVID hit, and oh my Lord, you know, we did our last NPIS conversion in April of 2020. During that time, and then a lot of things after that, we're dealing with COVID and sanitation and sanitizing things and putting up plexiglass shields, and you know, I think more important, you know, just trying to keep our people safe was number 1 goal, but also of great importance, and people sometimes don't think about this, is what would have happened if everything had shut down and there had been no food in the grocery store? It was bad enough to have a lot of things not on the shelves, but can you imagine the panic? Can you imagine? Anyway, it
actually was happening. The panic was happening, but that's really a story for another time, I think. But what I wanted, so you've taken us all the way through, and we talked so much about the different challenges, let's say, even getting into vet school, and all the way through a career that was manifested in ways that you had not planned or anticipated. And this is really what veterinary medicine can turn out to be quite routinely, especially as I've learned in all the interviews I've done so far, and my own personal story. But I feel at this point that that some of the key things that I've learned, which really came home to me, is that the networking opportunities are even greater than I had anticipated, and showing up to do a volunteer position can result in an invitation to do really fantastic paid work. that are incredible opportunities
I'm
to.
so grateful for, yeah.
Yeah.
I mean, I could have never planned it. It just happened. Yeah.
Yeah. Actually, what you're saying is a lot of what everyone has said so far, is that you just kept your eyes open for when an opportunity came in front of you. Your remarks were like, let's try it. I'm never going to forget that. Let's try it. And heck, it worked out, so that's awesome.
Yeah.
But I think the funniest thing, and I'm going to bring us to a conclusion here, is when you texted me, and I had said to all the board of directors and officers, okay, you guys, I have this idea. We're going to do this YouTube and podcast, and I'm starting out with interviewing you guys. Yeah, you all have to do it. And you're like, oh, okay. And I don't know, what's interesting about my life, what? We ever went overtime. I said, okay, I'll only keep you 30 minutes. How's that? So here we are at an hour and 30 minutes. All right.
Sorry well, hopefully you can edit this thing down.
No. I am not going to edit it, because I want to tell you something. This is fantastic. Right now, this one is fantastic, as particularly a podcast episode, because when people are, doing whatever, and they have their headphones in or what have you, and they're listening, they're going to be on this journey with us. I mean, yeah, you hit all the marks with it. And thank you so much for also putting in a good word for our association and showing people how important it is that it's applicable even to clinical practitioners, and that you're welcome. You don't have to have advanced degrees in alphabet soup, and we'll even put you to work to help us run it, and all the awesome things that we have on the horizon that we're going to do. So
I've always felt like I was in very prestigious company with this group. Once you look at the membership list, you're like, oh my God, they want me? Yeah.
Oh, yes, we do. We want everyone.
Yeah.
And so we're so happy that you were able to take the time aside and do this today. I know it's been a little tricky getting our appointments to work out and everything. So thank you so much for making it happen. And I just want to invite everybody to check the show notes. We're going to have the highlights of this really incredible career posted on the show notes. And also I'm going to have our association website address. Side note, we will be having a new website by June. And so keep an eye out for that. You guys are going to be shocked when you see what I've come up with. Yes.
I want to thank you, Donna, too, because you've done a tremendous amount of work and been very innovative, and sort of, it's kind of like, man, what is she doing? But
I know. That's what the Army used to say. I was, a year and a half in, and the colonels and generals in the back of the room. I was given a lecture one time in Poland about, this human animal bond therapy program I did in Kosovo, and you can see them in the back of the room like, what's DeBonis talking about now? So yeah, it's a thing. Yeah, but
Okay.
You know what, I couldn't do it without all the fantastic volunteers. I got so much support. So thank you all. Thank you again, Pam. I feel like we're friends now. So
well, maybe hopefully we'll get to meet in person someday. This stupid,
I know.
Are you going to be in Philadelphia for AVMA?
I'm thinking that I might have to be now, because I feel really compelled. I'm leaning that way.
The pandemic is now an endemic. We got to get on with our lives.
Yes, I'm leaning that way. I'm going to see how my finances play out and go from there. So it's all good. Well, thank you all for joining us. Keep an eye out. Our next episode will be out in a couple of weeks. And please like and share. And I really need everyone to subscribe to this channel, our YouTube channel, and our podcast both. And I'll have that information for how to access the podcast in our show notes. Thanks again, and bye.
Bye.